Hi, are you Josh White?
Yes.
Good morning, Josh. I'm Dr. McDuff.
Good to meet you.
Okay. I see from your chart you've already seen our nurse and that she's given you a decongestant and cough medicine for your upper respiratory symptoms, but you had also asked out front for some Ambien for sleep. Tell me a little bit about that.
Yeah, I just haven't been sleeping well lately. I just try to go to bed and I roll around for a while, and I think Ambien would just help me get the sleep I need to go to class and study.
Well, then, if you don't mind, I'd like to ask you a few lifestyle questions that often link to difficulty with sleeping. Would that be okay?
Yeah, we can do that.
Okay. I see from your intake sheet that you do smoke cigarettes every day and that you drink some alcohol on weekends. Tell me a little bit more about your smoking history.
Yeah, I've been smoking since high school, sort of off and on. I would say right now I smoke about 10 cigarettes a day. I don't actually drink very much. I drink maybe once on the weekend, but only like a couple beers to be social.
Right. Does your smoking tend to change during high stress periods or before studying for exams?
Sure, yeah. I mean, especially when I'm studying, I like to take smoke breaks every now and then, so I would say I smoke more definitely when I'm studying.
Okay. As far as alcohol, your typical pattern of drinking?
Yeah, I just drink very little, really socially, but not even really to get drunk, just a couple of beers.
Okay. What about prescription medicines? Have you ever taken a medicine that wasn't actually prescribed to you by a doctor?
Yeah, I mean, sometimes I take my roommate's Adderall. He has ADD, and it helps me study. So,
Right. So tell me a little bit about how it helps.
I can just study without breaks for maybe 10 hours if I need to. Just helps me concentrate for a long period of time.
Okay. What about other drugs like marijuana, cocaine, LSD, PCP, heroin?
I'm not really into any of that. I'm just trying to study and get into grad school, so none of that will help me.
Okay. Well, I mean, I'm concerned about your use of tobacco, and I'm concerned about your use of your roommate's Adderall. Do you have any idea what the exact dosage of Adderall is that you take?
Yeah, I mean, I think they're 60 milligrams slow release, and I take usually 2 of them.
Mm-hmm. Do you have some idea about the relationship between tobacco use, stimulant use like Adderall, and energy and sleep?
Yeah, I mean, I guess there's like a burnout period afterwards, so yeah.
I mean, what they might call a crash afterwards.
Yeah, I guess you could say that.
Okay. But any idea about what effect stimulants might have on your ability to fall asleep or stay asleep?
Yeah, I mean, I know, if I have caffeine too quickly before I go to sleep or anything right before I go to sleep, it takes me a little while, and lately, just with stress and everything, I haven't been able to sleep, so I think that Ambien might help me do that.
Well, I mean, I'm not sure if you realize what low, medium, and high dosages are as it comes to Adderall, but that's a particularly high dosage.
Really?
And definitely could be interfering with your sleep. So even after the stronger effects have worn off, it can often block your ability to fall asleep, and if that gets you to thinking, then you might start worrying about upcoming exams and how you'll do, and it just can get into a vicious cycle. So I'm kind of interested in whether you might consider changing up your studying routines. How ready would you be to do something like that, say on a scale of 0 to 10? If this is 0 and this is 10, where would you see yourself in terms of readiness to change that?
Maybe like a 5 or a 6. I mean, I know it's probably not the healthiest, but at the same time, I do get a lot of studying done. So I'm just trying to get a lot of sleep and then be able to keep going on these long studying.
Yeah. What have you noticed about sleep difficulties and test taking?
Yeah, I have noticed. I definitely space out a lot more. I think I get the chance to learn everything, but I space out and I kind of forget it sometimes, or it takes me a long time to recall something.
Yeah. Well, when you study, are you much of a coffee drinker?
Yeah, I usually drink coffee while I'm studying.
Uh-huh. And about how many cups would you say you drink during a study period?
A long study period, maybe, I would say like a cup every 2 hours.
Okay,
So
this is brewed coffee?
Mm-hmm.
Yeah. So brewed coffee has 100 to 150 milligrams in
Okay.
it, depending on how strong. So during a 10 or a 12-hour study period, you're at a high dosage of caffeine as well.
Yeah.
So based on that, based on your smoking and your caffeine use, but especially your use of high dosages of the strong stimulant, amphetamine salts, and the Adderall, I'd really like you to consider altering your studying routines. What do you think about that?
Yeah, I mean, I think I could cut back on some, but I don't think I could drop all that altogether. That might be a lot to just stop drinking coffee and taking the Adderall and stop smoking. I think it would just be a shock to my system. And right now, when I'm trying to study for exams, I don't think now would be a good time for me to try to change that up.
Well, let's take them one at a time. How difficult would it be to cut back on your smoking?
I could cut back. I mean, that's for sure. I usually go through periods where I try to. Yeah, I mean, I could probably try to cut back some. I don't know about quit altogether yet, but.
Right. And then what about caffeine? Could you just substitute, say, some decaffeinated coffee or another warm beverage or cold beverage just as part of your studying routine?
Yeah. I mean, sometimes my roommates drink tea, and I think that has some caffeine, but it's not as strong. And I think that part of it might just be having that drink in my hand that makes me think, or it kind of goes hand in hand with me studying. So, yeah, I could probably substitute like some tea in.
How difficult do you think it would be to move away from the Adderall?
I mean, I think that it would be really hard right now because I've got some big tests coming up. I mean, I know it's probably not a good thing. So in the near future, I might be able to cut back on it.
Well, in some ways you have to weigh the benefit of it in assisting your studying versus the negatives of potentially blocking your sleep, which then makes you tired the next day and also is not good for learning, organization, and memory retrieval. So I'd like you to consider cutting way back on your smoking, shifting over to some low caffeine or no caffeine beverage, and give a try for a day or two just to give up the Adderall altogether. See if you can't get your sleep pattern back. And in long study periods, it's really important to take regular breaks so that you allow your thinking and concentration systems to refresh. Is that something you'd be willing to consider, and then maybe come back and see me and see where you are in a few days?
Yeah, I mean, I could definitely put an effort towards that. It might be a lot to drop all of those things. I don't know. I mean, maybe I could keep the same amount of caffeine, or maybe even a little more. But I don't know if I can drop the Adderall, drop the caffeine, and cut my cigarettes down to very little.
Well, it's great that you're open to thinking about changing this, and give your best try with each of those, recognizing that when you add one stimulant to the next and to the next, it can be a really strong blocker of your ability to fall asleep, and can actually even raise your worrying level a little bit. And it's exam time, and you already know you're going to be a little bit apprehensive about how you'll do. Try to take a break at least every 3 hours. That'll often refresh your learning system, and then you'll be good for another 3 to 4 hour stretch.
Okay.
So what if we met back on Wednesday or Thursday, and I could just check in with you and see how it's gone, and we could take it from there?
Sure. Yeah, that's fine. Thursday I'm free after 2, so
Okay.
anytime after
I'll
that.
be here in the afternoon and all evening.